Hello, this is Optimum Health for All. I'm your host, OJ Odia.
Optimum health for all, for all, for all. We're building up strong so we never fall. Mindset, power, we're standing tall. It's optimum health, yeah, it's for all.
Today, we're going to talk about organized sports. Specifically, we're going to talk about health benefits, the health benefits of organized sports. Today, we have Dr. Chukwuemeka Agi. Dr. Agi is the director of our Sports Institute here in Port Harcourt. And he's also a medical doctor, consultant radiologist, and most importantly, a specialist in sports medicine. So I think he will be, well, I know that I'll be in a very good position to talk to us about organized sports and the benefits, health benefits of organized sports. Dr. Agi, you're welcome.
Thank you, sir. Thank you.
Now, we want to ask you, what is sports? What is organized sports? By way of introduction.
Well, sports is an activity that will involve physical or mental exertion in which people exhibit their skills. And there is also an interaction that might be competitive. So that is what sports is. When it is organized, it means that someone, a group, a body decides to make some rules to ensure that people can participate freely. And then, that group will now be, the beneficiaries of what will come out of it. So that is when it is organized. So the organization will involve, the sporting bodies. For instance, there will be an organization, let's say Badminton Federation will take care of badminton. FIFA takes care of, football at the world level. CAF at the national, at the African level,
yeah.
continental level. And then we'll have in Nigeria, we'll have the NFF and all those bodies. The same would apply, snooker organization, chess organization. So those bodies will. Now, in an environment where we have, or a group, an organization where we have people together, they can also come together to, organize themselves to participate in sport as a group. So when we say it is organized, we're looking at the group, participation. An individual can decide to, do sports, get involved in physical activity in order to maintain health. But when it is organized, somebody takes charge. Like in the universities, we have, the sports committees, organizing regular sporting activity for its members. The medical association as well. We have in the society different clubs, coming in to come and, organize themselves and encourage one another.
Okay, thank you very much. So we now at least clearly define the parameters of organization, that's organized sports. Now, what are the benefits of organized sports?
Okay.
We will now talk about the first benefits and then any other benefits that you think we need to know about. Yes.
Okay, thank you, sir. Very important question. The health benefits are many. There are so many. In fact, there are very few side effects or drawbacks for an individual participating in sports, So, and as we know, sports, would, and people are encouraged from the very young age to the aged, the elderly, to participate in sports. There are lots of benefits. The first one that we'll talk about is that when an individual wants to participate in sports, we usually encourage them to have no matter how little it is, a health check. So participating in sports might be an opportunity for somebody to be able to check, if their heart, their lungs, their vessels, if they are okay, their limbs, so it will be. And at that level, certain, malformations, certain problems can be detected early, and it will be taken care of. So that is the first thing that, can happen. Now, having been certified or having been evaluated and found to be okay to participate, there are now other benefits. Somebody who participates in, in sports, that individual would have the ability to maintain health. The individual does not easily get sick. Why? Sports or physical activity, in an organized way, improves the immune system. So the immune system gets stronger to combat diseases, combat ailments. So that individual, would be healthier. Now, when somebody participates in sports, the sportsmen and women, you can hardly see them being obese, overweight. So participation in sports, or, organized physical activity would enable somebody maintain a healthy weight. So that individual will not be obese. Of course, if somebody is obese or overweight, there are, diseases that go with it.
Yes.
There are cardiovascular diseases, heart, and vessel problems. There are problems that can come in terms of the brain too. There are problems that can come in terms of, the kidneys not functioning well. So that also is what, participating in sports will do.
Yeah.
Now, when somebody participates in sports, that individual usually would have a better mood. The individual will be, because participation in sports usually brings up certain chemicals in our body, which we refer to as the feel-good hormones or feel-good chemicals. So when somebody participates in sports, the person is, very happy. The person has a more positive outlook to life. Now, of course, we know, like we said, if the person is not obese, if somebody is out of shape, the person, may be ashamed. A young man, a woman, that is so obese, no. But when the person is trim, the person is fit and all that, then the person has a very good outlook. If somebody also has, participating in sports can, stop an individual, can, reduce the likelihood of somebody becoming diabetic, having the sugar, the body not managing sugar properly or glucose properly in the body. So it means that one, somebody, can, remain normal in terms of the glucose control, and not get diabetic. But for a diabetic who also starts exercise, starts, organized physical activity that is sustained, that individual, the sugar, the body now, usually takes care of the sugar better. So the person, the amount of drugs, if the person is on drug, will reduce because the person is involved in sports. The glucose goes into the body cells easily. Now, if the person is on insulin injection, the insulin need also reduces. Also, the body cells react better. They are more sensitive to insulin administration. So when we put all this together, it means that the problems associated with diabetes are usually less when an individual is a sports enthusiast. It has also been known that somebody who is involved in sports, the occurrence of the various cancers, are also on the, in low, low levels,
Yes.
because there are some cancers that are associated with obesity, increased, fat in the body.
Okay.
So for those cancers, it will also
Accidentally living. So on,
yes, sir.
Yeah. So we'll avoid all that.
Yes, sir. Now, we would also know that when somebody exercises, because there are different modes of exercise, there is the exercise that involves somebody, for instance, the foot pounding or, having contact on the ground. We say those ones, there is an impact. So there are high impact, sporting activities. There are, low sport impact, physical impact sporting activity. There is none, impact. The non-impact activities are like swimming. When somebody swims, there is no impact of the reaction, the footsteps on the ground, and then there is a backward reaction. No. Now, when somebody, for instance, does walks, works, the amount of energy or the force that touches the ground is also less. Or like when somebody is running. Actively running.
Marathon.
Yes. So when we put all this together, when somebody runs occasionally, walks occasionally, is active, that individual, the bones are usually stronger.
Yes.
The calcium and phosphates in the bone are usually maintained, and
With high density.
yes, it becomes more dense. That individual will not succumb to fractures easily, especially when they grow older.
Yes.
So older people, in terms of men and women especially, when their bones, when they have stored up calcium in the bones, the loss of that calcium is minimal. If the person is also active, even while
Sports,
older in sports, so that is the other benefit, that the fractures are less likely. Now also, if when somebody participates in sports, we know sometimes we see elderly people, they work gingerly, obviously because of the joints and arthritis and all that. When somebody participates in sports, the incidences and the prevalence of those arthritic pains and all that, it also is reduced. Yes, it is reduced. And there are activities in sports that will enable the individual also do some exercises in balancing. So it means that individual will not easily fall. So the individual can also maintain a good balance, So that is also another
advantage.
Yes, another advantage. Now the muscles will be well toned. If somebody, for instance, is involved in sports, for such women, let's say a woman, in pregnancy, you find out that labor, delivery, a lot of time the muscles are ready, the muscles have been primed. So it means that phase of life where giving birth, you also find out that the muscles are
much easier.
Much easier. They've been primed, so there is that that activity. The incidence or the occurrence of diabetes in pregnancy is also less for those women who participate in sports. Now another health benefit we see in those who partake in sports, even from a young age and continue even in the elderly, it also enables them so that memory losses are not as common.
Dementia is less.
It comes at an older age. They keep their mental status even for a long time. So, and because that also helps. Let us not forget that there are some sports that are not in terms of physical exertion as much as some others. If an athlete is a chess player, is a Scrabble player, is a draft player, those ones, it is more mental than physical. But of course, these individuals also exercise. They exercise, they physically exercise, even so that they can even endure the long marathons, for their sports. Yes. So mentally, they are also okay. Now, as a group, the benefits are very, very good. When we involve in organized sports, it becomes a social gathering. It becomes a social gathering where we would meet one another, we would chat, be happy, we would network, we would make friends. So these are, when one, when one does not participate in sports, you lose such friendships, you lose such opportunities. Now, if somebody also participates in sports and is willing to also share such information and knowledge with others, yes, you can have, like we said, sporting clubs. So it means that person with the knowledge can also organize their peers, their friends, to say, look, come, let us do this. And the benefits will be shared for all. If they do that, sometimes people can now join clubs where they will pay tokens. So the person who is also organizing that, session, those sessions would also benefit. So it's a win-win situation for everybody. The young, the adult, the older person. So there are still many that I'll be able to mention.
Talk about. Thank you very much. Thank you very much.
Thank you.
I'm sure our viewers have learned, well, not just a thing or two, a lot about sports and organized sports. Now let's just digress a bit. Can we do to encourage the young ones to participate in sports. You know, sport really starts from the very tender ages, and the school sports programs usually the where you get people into sports.
Yeah.
But unfortunately, some of these schools don't have playgrounds these days. In fact, many of our schools don't have playgrounds. There are some that still have very good playgrounds, but there are many that don't have.
Yeah.
How do we get those ones? In fact, everybody, primary, secondary, to engage in sports.
Yes. Well, Prof, the knowledge is the key. The good book tells us that people perish for lack of knowledge. So we need to educate people, maintain education, understanding of what is involved. Like you rightly said, involvement in sports should start at a very young age group, and then the health benefits will be known to all, parents, as well as teachers, as well as the school setting. Now, it is important first to have a healthy nation, to have a healthy group, before we start thinking about making champions out of them. If we have 200, if we have 1,000 people playing table tennis, out of that 1,000, we might have probably 10 that will be so good that they can now be encouraged, to now get to play professionally,
and make a career out of it.
Yes, sir. So what the first thing we would have to do is to, educate the teachers, the schools, to let them know, educate households about the benefits of people participating in sports. So for schools who don't have playgrounds, they can always go to a nearby,
and
they can also
use playground belonging to other schools, organizations, and so on.
Yeah, so that way we can get them early, get them early into the habit of having to exercise and the benefits of it. Now, when we have set that up, then we can now talk about organizing competitions among the schools, among the groups.
There are also ways of interacting and bonding.
Yes, sir. In the university setting, like the University of Port Harcourt, that is, an entrepreneurial as well as a sporting university, the association, the ASU, has organized itself such that they do works regularly. We have competitions amongst us, so we can do the same. We can get various, schools, primary, secondary, to be able to, come to compete, enjoy themselves, make new friends, and then participate in these sports. What it will involve, or what it will entail, would also be involving the state government, involving the private sector that we have around us, so that they can, also, encourage the communities. The government will play some role in it. In the Western climes, governments give some tax breaks, tax exemptions
for those who help sponsoring sports activities and so on.
Yes, sir. In the all over, well, even in the last Olympics, those who participated will tell you the amount of gear that organizations sponsor. Maybe the Team GB, Team USA, and all that. I was a sportsman. I was a football player for Nigeria in the 1991 World Universities Games in Sheffield. And where, in Sheffield, you see the Americans come. They have so much T-shirts. You see, the organization that is sponsoring.
So they also make themselves more visible.
Yes.
So it's a win-win.
It's a win-win situation. Okay. So we would have to encourage in this our setting too, because we understand the difficulty that individuals and families and households are going through. So if we can get companies to also pay a little to say, this competition is sponsored by this group, and then children will come participate, and then they are given small things and incentives, and we continue, to promote such activities. I am sure it will be easier. Habits are easy to form; they are difficult to leave, to neglect. So if we, make these children form this habit, this very good habit of being physically active, exercising, participating in one sport or the other, then we won't lose them when they grow up. So I think that's the way we can improve things in our
Thank
community
you
and
very
society.
much indeed. Finally, we have some problems in sports, organized sports. Problem of sudden deaths. There are not very many, but when they occur, it's spectacular and it's something that is in the news for a long time as well. And then things like use of performance enhancing drugs. So how do we minimize this?
Okay, sir. Well, I did mention early in our discussion that medical exams are usually important.
Screening.
Yes, medical screening is usually important. When I did my sports medicine course in the University of London, my dissertation was on pre-participation medical exams for Premier League teams or pre-contract medical exams for Premier League teams. So the one way in order to reduce incidences of sudden deaths, in sports, will be to do the medical exam. We said thorough medical exam. And thank you, Prof, that you that emphasis on thorough. Now, it is said that sports will make a good thing better, but also that sports will make a bad thing worse. If Kanu Nwankwo had not been evaluated when he went to Italy, to join Inter Milan, they now found that he had a prolapsed aortic valve. He had a challenge with the heart. One day he may have just slumped and passed on. We don't know what will happen. Yes, we don't know. But because they detected it, he had played in Holland, in the Netherlands, where their screening wasn't so rigorous. So one way we can at least the starting point will be ensure that everybody who participates in sports and then do the high-profile athletes, professional athletes, must be physically examined. And then we would have the various, basic investigations to check out the heart. We'll have the heart tracing, we refer to as the ECG. We'll have the heart ultrasound, we refer to as the echo. So at minimum, at least do those two, we'll be able to see. And then run the other checks.
Might do others.
Yes, sir. The history, sometimes somebody might tell you, my father died suddenly. Oh, my mother died suddenly. That, gives the clinician the impression that something is, may be happening in that household. So usually there is a history that they must feel. Are they hypertensive? Are they epileptic? Are they diabetic? So we would have all this.
Also help the whole family.
Yes, sir. Yes, sir. So that is one way that we can do in order to prevent. Now, because some of these things happen suddenly, even for top athletes that previously were normal, what it means is we keep doing a recheck every season. Before the season starts, the check is done. And then as we continue, there will be facilities to also counteract such sudden cardiac events. As we speak right now, a famous basketball player, LeBron James, is playing with his son with the Los Angeles Lakers. His son, while in high school, had actually collapsed, heart stopped while playing, but they revived him. So they had the equipment, the defibrillator,
to have the equipment,
ready, so that yes, sir, so that we can.
That will imply training of the
personnel, to use
coach, the colleagues,
yes, sir, on
identifiers, sports medicine experts,
yes, sir,
and so on.
Yes, sir. Okay. We just to mention again, Fabrice Muamba, the famous case where his heart stopped for 78 minutes, but all that time they were doing the external cardiac, massage. They were doing the defibrillation. They were checking 78 minutes. So he was brought back. So if we are ready, we can, to some extent, avert such disasters.
Yes. Thank you very much.
Thank you.
I'm so happy that you are here today and are giving us all this. Thank you very much for coming. Viewers, this is Optimum Health For All. Thank you very much for watching. Please share, subscribe, Bye for now.
Optimum Health For All, for all, for all, for all. We're building up strong so we never fall. Mindset, power, we're standing tall. It's Optimum Health, yeah, it's for all. Knowledge is wealth, so we pass it on quick. From the food to the mood, we be flipping the script. From gut to brain, everything aligned. When you live that good life, it's a powerful sign. Balance is the mission, got the vision on deck. Cut the stress, no mess, keep the wellness in check. When we thrive, we shine with every routine. Optimum Health, you know what I mean. Optimum Health for all.